Welcome to today's program, and thank you for joining us. I am C. Virginia Fields, former Manhattan Borough President and current President, CEO of Black Health, formerly known as the National Black Leadership Commission on AIDS, Incorporated. In 2019, after a 2-year rebranding process and 32 years of service to the African American community, the National Black Leadership Commission on AIDS became known as Black Health. Our mission is to promote health and disease prevention within the Black community through advocacy, education, and policy. Our vision is to reduce disparities and achieve health equity for Black communities. Now, this was a major development, this rebranding. This is an organizational evolution that expanded our health focus areas to address multiple health issues and disparities disproportionately affecting African Americans, including HIV, hepatitis C, cardiovascular disease, breast cancer, prostate cancer, sickle cell, diabetes, and mental health, all of which disproportionately impact African Americans at vastly disproportionate levels in comparison to other racial ethnic groups. Guests have joined me from around the country for a discussion on topics of interest to you, our viewers, and we've had some phenomenal guests. Today's edition, however, of Health Action TV is different and unique on several fronts. After 15 years as the organization's president and CEO, I am retiring from this position. And during my tenure, I am enormously proud to have been able to help stabilize this organization that is now 38 years old and to lead its rebranding for becoming a national education, advocacy, and policy organization. And I'm pleased to say that my decision to retire presents an opportune time to bring on a new leader to now drive Black Health's mission and vision for its next chapter of addressing health disparities and achieving equity within the Black community for generations to come. So I am happy to introduce Black Health's incoming president and CEO, Ms. Shirley Torho. And I am delighted, Shirley, that you have accepted this appointment and will be my successor, having worked with Black Health as a consultant for 8 years and served as a member of the board of directors. Shirley brings a perspective and strategic direction that is much needed during this time of transition. She is an accomplished, enthusiastic, and committed leader with a wealth of valuable experience at the local, state, and federal levels, and comes to the position at a time when our public health system faced many challenges. So welcome and congratulations, Shirley, to this new position. I know it's going to be amazing, and we're just going to have a conversation. The good news is that we've known each other for a number of years, and your experiences, which we will, of course, add at the end, how to contact you and read your resume, because it is far too long to even begin to talk about it, so we won't even go there. So let's just have a conversation, Shirley, about the work of the organization and the public health landscape, which we know is not only complex, but it is rapidly changing. And a lot of what we're seeing does not support our communities. So let's talk a little about, number one, your own experience in the area of public health and how you see some of those experiences of making a difference as the president CEO of Black Health.
Well, first of all, thank you for having me. It's always an honor and privilege to sit with you and to chat with you just about the work, about life in New York City and across the country, and all of the ways in which our communities are impacted. But I'm so grateful to you and, really welcome the opportunity to be your successor, to fill huge shoes. But I do believe that, as you said, I am well prepared, and, our long history certainly supports me in being able to do this work. And so I would say that, just given the landscape in public health right now, you mentioned earlier, the shift from the National Black Leadership Commission on AIDS to now Black Health. And I think in a lot of ways that rebranding of the organization really speaks to some of the complexities that we see in public health, right? So the need to talk about health disparities as a larger structural systemic thing that affects Black communities, Black and other marginalized communities is really important. And I think that why that shift to talking about health disparities as opposed to just one illness or one epidemic like HIV is important is because it gives you an opportunity to really leverage and maximize the resources that you have to tackle a lot of difficult things that often fall by the wayside, right? We have these big, buzzwords and these big epidemics that we focus on one at a time. But really, when you leverage your resources to talk about all of these things simultaneously, you have an opportunity to have more impact and to expand your reach in the communities that we serve.
And I think that, and I'm glad you mentioned that, because I think that as we've now gotten into looking at the evolution of the organization, and of course, as you said, one of the reasons we made the decision because we fully understand the intersectionality between HIV and these other diseases. And I think we all saw during COVID how that impacts our community and our population. So coming in at this time, and I know you've done a lot too, Shirley, in terms of trainings and around social disparities and differences that need to be addressed. So how do you see this now in terms of the work at the organization and our ability to expand more nationally as far as our education, our advocacy, and our policy work?
Well, and I think that that's an important question to ask, right? Because I think the power of talking about health disparities is that, again, you're addressing systems, right? And so you might not be able to reach somebody when you're speaking only about HIV.
Right.
But when you talk about breast cancer, when you talk about sickle cell, when you talk about a family member experiencing mental health, you have a lot of different angles from which someone might engage with the work. And so I think when it comes to engaging communities, these include community members who, Black Health already has access to, but it also includes new people, right? New community members, people who have never had a need to connect with, health systems prior. Even when we think about the importance of engaging young people, engaging youth, and bringing them to the table to be able to talk about their health and what the health of future generations looks like, it really expands our reach. And so from a national perspective, I think health disparities really also lends itself when it comes to policy and advocacy. And I know that, Black Health is an education, policy, and advocacy organization. And so as we think about these systems that are really impacting our communities, we need to be able to have programming and data that support policy and advocacy recommendations that impacts communities nationally, and that we can take to our leaders and say, here is what the data says, here's how people, are experiencing these things, and here are our recommendations for change, for positive outcomes and for positive impacts. And so I think, when I think about Black Health in the next 5 to 10 years, it really is about that, being that voice of the people, yes, right? Continuing to be a voice for the people, but really being a voice for those who maybe historically haven't had an opportunity to see themselves in this work.
And you touched up on another important point, and that is the next generation and our youth. And that's another reason I'm excited, because as I am passing the torch in terms of you, in terms of your generation and the young people, that we really need to bring more into this discussion. I know we have a rather robust internship program, and I think that that has helped a lot to encourage younger people to even think about a career or profession in public health. And I think that this is a good time now to really move in that direction. And I think that that's going to really be helpful too to the organization as we continue to build.
Absolutely. I mean, we continue to hear from, old and young, right? This is really an intergenerational experience of Black and brown people not seeing providers who look like them, right? And so I think one of the hidden secrets, if you ask me, about Black health is this amazing pipeline of young people who are doing the work, right? Who maybe have never thought that they could go into any of the health professions, right? Or maybe growing up, they only thought about becoming a physician or a nurse, and now they know that, oh, I can go into health policy, I can go into public health, I can become a researcher, right? I think Black health has really helped to open the doors for a lot of young people who
and
really
expose them to other parts of the public health
of
system.
the professions, right? And so, I think that really speaks volumes. And so when we think about the youth pipeline, I think it's also important to think about the impact that they have, or the potential to have impacts when it comes to things like cultural competency and implicit bias, right? Seeing future health providers who look like you when you're a patient is really important. And so, we really are tackling a lot of these issues, simultaneously. And, again, when your resources are limited, as we know in this era, of budget cuts and shortages in funding for this kind of work, it's really important to maximize what you do have to be able to have this kind of vast impact.
And I guess for me, one of the things that I have found very discouraging in working in the nonprofit field, coming from as an elected representative, the resources, the lack of resources that even government looks to invest in nonprofit is rather disturbing, because nonprofits do what government can never do. And without the nonprofits, a lot of the social issues and the concerns and the disparities as we know them would certainly not be addressed in the way that nonprofits do. So I think you're coming into this with your background and experience too, expanding the resources within the organization beyond just government. I think it's going to be extremely positive. What do you think?
Oh, I mean, 100%. I think in an ideal situation, we wouldn't have to rely solely on government for funding. That's the reality of the situation, is that a lot of smaller nonprofits do sometimes depend 100% on an organization or on government funding to do their work. But there is power in really leveraging partnerships and really identifying stakeholders, across different sectors that can really support the work. And so, I'm completely on board with you when we talk about, sustainability, and what that means is being able to really diversify our resources so that we're not having to rely solely on government funding. Now, that's not to say that we're not grateful. We're absolutely grateful.
We are definitely grateful. Make no mistake about it.
And if you're watching, we want your money. We want your money to be able to do the work.
It's very clear that, and I think government has a role to play.
Absolutely.
Because again, the work that nonprofits provide, or the services that nonprofits provide, even in partnerships, and I see it as a partnership between government as well as the private sector and the corporate sector.
And even community members.
And even community.
Absolutely.
So touching all of those different sectors really makes it work. And I can speak about that just even from my own experience. And as I, move to retire from this position, to reflecting on the the work that I look to see and hope to see Black health continuing as it expands its reach on a national level through the education, through the advocacy, through the policy, because I think we have all experienced, no matter how much education we do, whether it would have been with HIV, we think, okay, people got it. We can stop this now. But it doesn't stop. The education is needed over and over and over again. And when we look at diabetes and its impact upon our communities, what can we do in order to make sure that people have good information? And it's not all just about, self-care, but there are a whole lot of other issues like policies and making sure that the policies are changed so that the resources and the information continue. So,
yeah, absolutely. I mean, you can, as an individual, you can do everything you need to do to take care of yourself when it comes to some of these chronic diseases that we see in our communities. But if our leaders aren't stepping up to help shift the policies that, really facilitate some of these disparities, then, you'll continue to see the gaps in health, right? And so an example of that is something that, we're starting to talk a little bit more about is the impact that the urban environment, the physical environment has on people's health outcomes, right? If you live in the middle of the highway or a freeway and you have exhaust fumes and trucks passing every morning, every afternoon, every evening, and you're a child with asthma, if your windows are opened, you're going to continue to get sick.
And so many of our communities are on that path.
They are on that path, right? So whether or not you're controlling your asthma, your parents are controlling it, you're doing everything you need to do, the moment you step outside, a lot of that goes out of the window. And so how do we continue to work with our leaders and not just, policymakers, but architects, working with folks who really understand public policy and understand the impact that health has, not just on individuals, but on populations, right? We want to be able to get all of these various stakeholders together in a room and really make some critical decisions, because
I think
that's where we are in the work.
And I think that's one of the advantages and real opportunities I've always felt with Black health is we're able to expand that base. It's not just working within the field of public health, but making the connection, as you said, between developers, people who design these communities, and making sure that the issues that continue to support disparities, health disparities, or make it possible systemically, that's the word I was trying to think of, that having a sense and an understanding of the connection and willing to address it on from a broader basis or scale, I think is one of the real plus for an organization like this, Black Health. We don't shy away from, getting involved with those decisions when that are being made about what gets built in a community. What is the environmental impact? Have we looked at it from the transportation, from the schools, from the sewage system, its impact on health? A healthy community is a livable community.
Absolutely.
And that's one of the great parts that I have enjoyed with this organization.
Yeah, I definitely, I want to hear more about some of the things that you've enjoyed, but before I get there, I do want to say that, what you're speaking to is the social determinants of health, which, we've talked about, the social, structural, and the political determinants of health. And so, nutrition, mental health, where you work, do you have access to clean water? Do you have access to fruits and vegetables in your neighborhood, right? These are all things that we need to consider when we have the conversations. But we also
parks, recreation,
what technology,
do your sidewalks look like, and all of that.
What's the impact that AI is going to have on health, right? This is something that we now have to concern ourselves with. And so, there really are lots of great opportunities for us to build relationships and partnerships. And so as we think about our national visibility, right? It's expanding beyond the health sector and really thinking about how we can be strategic, not only because of resources, but also because you just get a little bit further when you have great partners in great places.
Right. And that is also, I think, a big part of the interest we had with the rebranding. When we look at the other health-focused areas, I mean, just even around breast cancer, the work that is possible and the relationships, the partnerships, the education. We certainly have a very distinguished person on our board, Dr. Bert Peterson, who has been doing a great deal of work as a surgeon, a breast cancer surgeon, and through his work to be able to educate more about just resources that are not necessarily made available a lot in the communities where Black women receive care. So those kind of opportunities that Black health is able to move into spaces, I think is extremely important.
Yeah, well, I'm definitely looking forward to it all, and being able to really usher the organization into its next chapter, as you get ready to retire soon. So I did say that I wanted to hear a little bit more about some of the things that you've enjoyed the most, in the last, decade plus years that you've been with Black Health, but also what some of your desires and hopes for the organization are.
Yeah, and I think probably I've covered some of it as just we generally talked about, just even expanding our focus beyond just HIV. Because working in the field, recognizing that HIV does not stand alone. And when we look at the diseases, pretty much the 8 or so that Black Health has included now, they are related, very much so. And so being able to lead on that expansion, I think, has been very rewarding. And of course, the expansion came right before the pandemic. And like other organizations, we had to pivot, we had to shift, and we were very much involved during that time, not only here in New York City, but on a national level, testing, tracing, and getting people tested and getting the information out there. That was very rewarding. So after, I guess it was about, 2023, when things began to die down, even though we still have COVID. To think about now diving more into why we rebranded and what that means as far as addressing disparities and the focus on education, advocacy, and policy. I think it's been very rewarding, and that's a very special time, and that has been a lot to me to be able to turn the organization in this direction. And now at a point with you coming in to really dive deeper into the next level of this organization. But it's also been very rewarding to just engage with people from around the country and learn a lot about what they're doing and the fact that we don't stand alone and the opportunities that exist. And I think that will continue. And so all of it has been really good. I've gotten to meet some great people, have wonderful experiences, and we're going to be doing a documentary on the organization because I think it's a story worth telling, and that we can do more to tell that story. And that's going to be something over the next 3 to 6 months that I certainly hope and look forward to be engaged to tell our story. So all of it is good. All of it is really good, and this is a great time, and I'm just really excited about it. And I want to use my voice, continue to use my voice, but in different platforms. Some will focus on health, others on social issues, civil rights, and the whole issue around civic engagement. I think it's all very important work that I want to continue to do.
And they're all related, as we've been talking about.
Very much related. Well, Shirley, I think that, there's a lot to come and a lot more to do. And I'm just excited that you're here and is going to be a part of doing this work, and to have you joining us as our new president and CEO as the leadership of Black Health, I think is very exciting. So as we look to the future, I'm confident that our new president, CEO, is the right person to lead Black Health, and will continue its legacy of addressing the historic and present failings of the U.S. health system to prioritize high quality, equitable, and culturally relevant health care to historically overlooked and medically neglected communities. Shirley's enthusiasm and journey will certainly invigorate our community and viewers in lifting our collective voices to better educate ourselves, our loved ones, and the broader communities, and to demand corrective action on policies and biases which continue to be propelled by sexual racism. By doing so, we can eliminate the disparities and secure better outcomes. So for more information about Black health, please visit our website and look for us on Facebook, X, the former Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to better inform the viewers about the important topics that impact your health, well-being, and we ask you to please let your family, your friends, and your neighbors know about this programming. I am C. Virginia Fields, and I thank you for joining us and hope you will continue to tune in for Health Action TV here on Manhattan Neighborhood Network. And I look forward to joining you in the future for more important discussions as the work that continues and as we pass the baton to be able to keep you, our viewers, informed. And thanks so much to Manhattan Neighborhood Network for the tremendous work that they do in bringing these important topics and discussions to you, our viewers. Thank you.